Those of you who've been shoveling snow and maybe have some injuries from some winter activities, we have some help for you today. Dr. Khan is here from Wasatch Pain Solutions, and you have a way of helping people without injections or surgery.
Well, it's definitely things that we can do without surgery. Injections are very difficult because those are going to be needed to a certain degree.
But not the steroid injections that people will sometimes do. Talk about what you do with Regenexx.
So we use your own blood platelets to actually get the natural growth factors that are in those platelets to use for your body to heal itself from within. So it actually encourages blood supply to come in and normal cells that would normally be there to help repair, so that you have a longer lasting effect.
So would this be just for pain, or do you need to actually have an injury to have this procedure done?
Traditionally, pain can be one source of reasoning why you want to treat it, but traditionally an injury of some sort, whether it's a torn disc, whether it's a herniated disc, bulging disc, even things like arthritis in the back can cause pain like that.
Really? Mm-hmm. And what are we seeing most, what are you seeing right now really with back pain, and where are people most injured in their back?
Traditionally, low back seems to be the predominant area. Necks are next after that. And then the mid-back, you know, a lot of people don't believe there's a lot of things that happen in the mid-back, but there's 12 different spinal levels, and they do certainly herniate periodically.
Gosh, the graph that we just saw, the Regenexx helps so much more than a steroid injection.
Correct.
It's amazing.
Yes, yes, and that's the amazing part. Following these patients in our track registry, it makes sense that they're seeing much better functional outcomes than the patients that have steroid injections.
You've talked about it before on the show, but what is the process when you want to go in and do this?
So you come in probably 1 to 2 hours before your injection, and we draw your blood, basically, just like going to a lab draw or going to the doctor's office to get your blood drawn. Then we process the platelets in our office in our biosafety hood and FDA-approved lab, and then use those concentrated platelets to inject at that 1 to 2 hour period afterwards.
And what's the recovery process like?
It's pretty limited. I mean, traditionally, the worst is just maybe some slight discomfort at the site of the injection. But besides that, most people don't notice any increased pain at all.
Well, it's just such a difference from surgery.
Correct.
Surgery takes so long to heal from, and some of the rehabilitation that you have to do with all of it. And this is, as you're aging, this helps you with pain and really staying younger.
It does. You know, a lot of times people don't realize surgery does damage some tissues. Mm-hmm. While they fix you, they do certainly leave you with a part that's not perfect anymore. And so therefore it will degenerate again at some point.
Okay, well, this is an amazing alternative. Dr. Khan with Wasatch Pain Solutions. If you want to contact him, his number is 801-302-2690, and we'll put all the information on our website. Dr. Khan, thank you so much.
Thank you.
All right, coming up next, Nisha is in the kitchen with her chili cheese dip. It's 3 ingredients. She says it's incredible. We're going to check it out.
We're just tasting it, and it is delicious.